Imagine like the absolute best memory foam mattress you've ever slept on. You know, the
Oh,
kind.
yeah. The kind you just sink into.
Right, exactly. So you press down, the material yields perfectly to your shape, and the moment you get up, it snaps right back to its original form.
Like it was never touched.
Exactly. Now imagine if society somehow convinced you that your own internal memory foam was permanently broken, like it was just entirely unable to rebound.
That's a really heavy thought.
It is. And today we are stepping into a topic that affects um, an astonishing 24 to 38% of women.
Which is a massive statistic.
Huge. And it actually happens to be the #1 reported physical change following childbirth. We're talking about vaginal laxity or, the sensation of looseness.
Yeah, and it's a massive statistical reality, like you said. The sources we're looking at indicate women report this sensation even more frequently than weight gain
Wow.
or stretch marks or even incontinence. Yet, almost half of the women experiencing this they're entirely too apprehensive to bring it up with a doctor.
Because there's so much shame attached to it, which creates this perfect silent vacuum, right? Like a vacuum for misinformation and predatory marketing to just fill right up.
Oh, absolutely. The internet is full of it.
Right. And we are not going to let that happen to you. So for this deep dive, we have compiled a really serious stack of sources to just cut through all that noise.
We really went everywhere for this one.
We did. We're bringing in the latest medical guidelines from the UK, so that includes the British Menopause Society and, nicely, the National Institute for Health and Care Excellence.
Which are the gold standard over there.
Right. And we're also pulling clinical data from the Cleveland Clinic, an incredibly detailed study out of Johns Hopkins University, and this really fascinating look at pelvic floor mechanics from Korea, plus, a bunch of comprehensive gynecological reviews.
So it's a very rigorous look at the actual biomechanics of the female body.
Yes.
We're really trying to separate the physical reality from, the subjective anxiety around it.
Exactly. Our mission today is to completely untangle the myths surrounding vaginal size, length, and this whole sensation of looseness. We are going specifically after the big focus question.
Right, the one everyone wants to know.
Does vaginal length actually affect the perception of laxity? We're going to explore what is physically happening at like a cellular and muscular level when someone feels loose.
Because there is an actual mechanism happening there.
Right. And we will break down what the science actually says about this absolute explosion of devices claiming to fix it. So just consider this a completely safe, shame-free space.
We are literally just two people marveling at the incredible engineering of the human body.
Exactly. So let's just dive straight into that engineering because, before we can diagnose why something feels different, we really have to look at the baseline anatomy.
We do. And there is this deeply ingrained cultural myth that a vagina can be, permanently stretched out.
Right.
Or that its physical depth somehow dictates its function.
Yeah, and I was looking specifically at the Johns Hopkins University study on this, and I fully expected them to find some kind of direct correlation, like between the physical dimensions of the anatomy and sexual dysfunction.
It seems like common sense, right?
Exactly. But
Yeah.
they actually debunked that entirely. They took 505 women aged 40 and older, and they meticulously measured two things.
Right. The total vaginal length, or TVL.
Yes, the TVL and the genital hiatus, which is basically the opening.
And their findings really, they just challenge all those common assumptions.
They really do.
Because they paired those physical measurements with the female sexual function index. And the conclusion was definitive. Vaginal size and length did not affect sexual activity or function.
Not at all.
Not at all. There was virtually zero difference in the genital hiatus measurements between women with normal sexual function and those experiencing sexual dysfunction.
That is wild. I know they did note that the sexually active group had slightly longer vaginas on average, but that wasn't actually caused by the activity itself, right?
No. The researchers realized that slight difference was simply a statistical artifact of age.
Oh, I see.
Yeah, the sexually active group just happened to be slightly younger on average, and tissue naturally changes over decades. The physical act of intercourse does not permanently lengthen or widen the canal.
Which makes sense.
Right. In fact, the average unstimulated vaginal length is only about 2.5 to 3.7 inches.
Wait, really? That small.
Yeah, it's quite compact at rest.
But during arousal, I mean, the mechanics change entirely, right? The whole structure basically shapeshifts. The internal length actually increases to about 4.25 to 4.75 inches.
It does. The body adapts.
And I was reading about the walls of the canal, and it completely reframed my whole understanding of this. They aren't flat, rigid tunnels.
No, not at all.
They are made of these dynamic folds called rugae. So instead of a static pipe, it functions much more like an accordion.
That's a great analogy.
Right. When it's not in use, those folds just kind of collapse in on themselves and rest together. And then when it's necessary, whether for arousal or childbirth, the accordion expands.
And that accordion mechanism is just crucial to understand. During arousal, the uterus and the cervix physically lift up and out of the way.
Which is crazy to picture.
It is.
Yeah.
But it allows that upper two-thirds of the vagina to unfurl and accommodate whatever is happening.
Okay, but I have to push back here for a second, though.
Sure, go ahead.
Because the accordion analogy makes total sense for arousal.
Mhm.
But if a human being pushes an 8-pound baby through that exact same canal...
What a major event.
Yeah.
Yeah.
It just defies logic that it wouldn't stay at least a little bit stretched out. Like, if I stretch a thick elastic band around a watermelon for a few hours, that band is going to be compromised.
It's going to be loose.
It's never going to be the same size again. So how does this organ bounce back?
So that is the most common intuitive lead people make. But it treats human biology like dead fabric. A rubber band is a synthetic material that just degrades under tension. Vaginal tissue is highly vascular, living, biological tissue designed specifically for extreme temporary dilation.
Ah, okay, so it's built for it.
Exactly. The tissue itself possesses incredible elastic recoil. It does not permanently widen or stay stretched out like a ruined sweater.
So if living tissue naturally snaps back, like the memory foam we talked about, and the actual length of the organ doesn't dictate how it functions, what is actually failing when someone feels loose?
Right, because the symptom is real.
Because the distress women report is very real. It's not just all in their heads.
No, the distress is absolutely real. But to understand it, we really have to separate anatomical displacement from a subjective sensation.
Okay, break that down for me.
So laxity is a sensation. It's a feeling of reduced friction or looseness. It is not the same thing as pelvic organ prolapse or POP.
Let's define prolapse really quickly, actually, because the sources note women frequently confuse those two things.
Yeah, they do. So with pelvic organ prolapse, the internal supportive structures have fundamentally failed.
Like broken down.
Yes. And because of that structural failure, adjacent organs like the bladder, the uterus, or the rectum are literally sagging down into the vaginal space.
Oh, wow.
Yeah, a woman might feel a physical, visible bulge or a heavy dragging sensation. Prolapse is an anatomical structural shift. Laxity, on the other hand, is a sensory symptom.
Got it. And the fascinating part is that the sources point to two completely different root causes that produce this exact same sensation of looseness.
Yes, two totally different pathways.
Right. So if the vaginal wall itself isn't permanently stretched, the issue has to be surrounding it or chemically altering it. Let's look at the first culprit, which is postpartum muscle weakness.
Yes.
Instead of visualizing the canal itself stretching, the sources suggest we need to look at the pelvic floor muscles, specifically this group called the levator ani.
Yes. Think of the levator ani as like the thick cables of a suspension bridge holding up the entire pelvic floor.
Okay, I'm picturing that.
During a vaginal delivery, a baby acts like an incredibly oversized, heavy semi-truck driving over a bridge that usually only handles light traffic.
Right.
The cables don't necessarily snap, but they get severely overstretched.
They lose their tension.
Exactly.
So the sensation of looseness a younger woman feels after having a baby isn't because her vaginal canal is permanently wider.
No.
It's because the suspension cables, the muscles surrounding it, are just exhausted, fatigued, or straight up injured. It is entirely a muscular issue.
That captures it perfectly.
Yeah.
The supporting musculature simply isn't providing the same compressive resistance it used to.
It's just tired.
Yeah. But that is only one cause. The data also highlights a massive demographic of women experiencing severe laxity who haven't just delivered a baby.
Yes, women entering menopause. And this is where it gets really interesting. Because if there is no semi-truck stretching the suspension cables, what is the mechanism causing looseness in a 50-year-old woman?
Right, because the muscles might be totally fine.
Exactly.
So we are looking at a completely different biological pathway here, which is known as the genitourinary syndrome of menopause, or GSM.
GSM.
Yes. In this scenario, the primary architect of the tissue changes is the sudden drop in estrogen. Estrogen is basically the biological fuel that keeps the vaginal mucosa thick, highly vascularized, and super elastic.
So when that fuel gets cut off, it triggers this whole domino effect. I want to break down exactly how this happens because the biology here is just fascinating.
It really is a chain reaction.
According to the reviews, the first thing that happens when estrogen drops is that the superficial epithelial cells, like the top layer of the tissue, they stop shedding as frequently.
And that shedding is vital
Right.
because when those cells slow off, they release glycogen. And glycogen is essentially the food source for the healthy natural bacteria in the microbiome, particularly the lactobacilli.
Wait, so the healthy bacteria rely on the tissue constantly shedding to eat.
Yeah.
And when the bacteria starve, what happens to the whole environment down there?
Well, the lactobacilli normally produce lactic acid, which keeps the environment at a highly acidic, very protective pH level.
Okay.
So when they die off because of a lack of glycogen, the pH rises.
It becomes less acidic?
Right. The environment becomes more alkaline, which directly leads to dryness and a much higher risk of infection.
Wow.
But the domino effect doesn't even stop at the surface. Deep within the connective tissue, the cellular factories that produce collagen basically go dormant.
The sources mention that the existing collagen fibers hyalinize. Does that mean they essentially crystallize or get glued together so they can't slide past each other anymore?
That is exactly the mechanism, yes.
Yeah.
The collagen fibers become homogenized and stiff, and simultaneously the elastin fibers, which are the biological springs that give the tissue its snap, they actually begin to fragment and break apart.
That is a staggering biological shift.
It is profound.
The tissue is literally losing its mechanical ability to respond. So if you are listening to this and dealing with a loss of sensation or a feeling of looseness, it could be two entirely different things.
Completely different.
Right. A postpartum woman is dealing with exhausted suspension bridge cables like her muscles, whereas a menopausal woman is dealing with fragmented elastin and glued together collagen. Her actual tissue has changed its physical character.
And you've just isolated the core reason why a generalized vaginal tightening approach is medically flawed.
Because the causes are different.
Exactly. Doing intense muscle exercises won't repair fragmented elastin or restore glycogen for a menopausal woman. And applying estrogen cream won't instantly repair the overstretched suspension cables of a postpartum woman.
Which brings up this massive logical jump people tend to make. If the problem is looseness, whether from muscles or tissue, the immediate assumption is that tightening everything up as much as possible has to be the ultimate goal.
Right, tighter is better, they think.
Yeah, like the tighter the bridge cables, the better the function. But the Korean study we looked at completely upends that idea, doesn't it?
It does, and it highlights a very dangerous misconception. Researchers in Korea took 42 women dealing with stress urinary incontinence, and they decided to objectively map out their pelvic floor mechanics.
Using actual data.
Right. They used an instrument called a perineometer.
And for those who haven't encountered one, a perineometer is essentially this small inflatable vaginal probe connected to a pressure gauge.
Correct.
When the pelvic floor muscles contract, they squeeze the probe, displacing the air inside it. And the machine measures that resting tone and active squeeze in millimeters of mercury, or mmHg.
Yeah, so it provides hard, objective data on exactly how much compressive force the muscles are generating.
Which is super useful.
Now, the initial findings aligned with what you might expect, higher pelvic floor muscle strength, did positively correlate with an increase in desire, arousal, and overall sexual satisfaction.
Which makes sense on a surface level. Stronger muscles equal better blood flow and better mechanical function.
Right. But the researchers applied a decision tree analysis to the data to see if that upward trend continued indefinitely. And it didn't.
There was a limit.
They discovered a very specific biological ceiling. If a woman's vaginal resting tone crossed a threshold of 15.2 mmHg, that heightened tightness no longer predicted satisfaction.
Wait, what did it predict?
It actually predicted a sharp rise in pain-related sexual dysfunction.
Dyspareunia. Pain during intercourse. So if the baseline pressure is too high, it's not a sign of superior health.
No.
It means the pelvic floor muscles are hyperactive. They are locked in a state of chronic spasm.
Think about walking around all day with your shoulders tightly hunched up against your ears.
Oh, it sounds awful.
Right. The muscles are technically engaged and strong, but they are also exhausted, rigid, and causing you intense pain. Extreme vaginal tightness is a medical complication. It's not a cosmetic ideal.
So the objective isn't maximum tightness, it's the Goldilocks zone.
Exactly, the Goldilocks zone.
You want muscles that are strong enough to provide support and friction, but relaxed enough to allow for painless expansion. That completely changes how we should look at treating this.
It does.
If the goal is optimal tone, and we know we are dealing with either muscular fatigue or hormonal tissue changes, how do we actually get to that Goldilocks zone?
Well, the global medical consensus relies on two gold standard treatments, depending on the root cause. If the laxity is muscular, the exhausted suspension bridge from childbirth, the primary intervention is pelvic floor muscle training, or PFMT.
And this goes far beyond just telling someone to do Kegels, right? The sources emphasize working with a specialized pelvic health physiotherapist.
Yes, because without ultrasound biofeedback or tactile guidance from a physiotherapist, many women simply end up clenching their glutes or their abdominals.
Which does absolutely nothing for the levator any.
Nothing at all. Furthermore, rehabilitating a muscle group takes physiological time. You don't build noticeable bicep hypertrophy by lifting a weight twice. The data shows it takes 6 to 16 weeks of highly specific, consistent training to actually rebuild the structural integrity of that pelvic floor.
So it is literal physical therapy. Now, what about the hormonal side? If the issue is genitourinary syndrome of menopause and the tissue itself has fragmented its elastin, no amount of physical therapy is going to fix that.
True. In that case, the gold standard is localized vaginal estrogen.
And I want to clarify localized here because the word estrogen often scares people who associate it with the systemic risks of traditional hormone replacement therapy, like blood clots or breast cancer risks.
That is a vital distinction to make. Local estrogen comes in the form of very low-dose creams, tablets, or small flexible rings inserted directly into the vagina.
So it stays there.
Exactly. Because it is applied directly to the mucosa, very little of it enters the systemic bloodstream. It binds specifically to the estrogen receptors in the vaginal tissue.
And when it binds, it reverses that whole biological domino effect we talked about earlier. It signals the epithelial cells to start shedding again.
Which feeds the lactobacilli.
Right. Which drops the pH back to a healthy acidic level. It essentially just wakes up the collagen factories. For a lot of women, simply restoring the tissue's natural, responsive biology entirely resolves the subjective feeling of looseness.
It's remarkably effective.
Okay, but we have to address the massive elephant in the room here.
Let's do it.
Because if a listener searches for solutions to vaginal laxity online today, the top results are not going to be 16 weeks of specialized physiotherapy.
No, they are not.
Or localized estrogen creams. They are going to be bombarded with slick advertisements for energy-based devices like lasers and radio frequency treatments. And our own sources actually examine these. There is a study from the Journal of Obstetrics, Gynecology, and Cancer Research that looked at a specific treatment called Higgs radiofrequency.
Yes, the Higgs RF study. It's frequently cited in the cosmetic gynecology space.
The researchers took 22 women suffering from vaginal laxity. They administered 6 sessions of this radiofrequency treatment, spaced 2 weeks apart, and the published results look incredibly impressive.
They do look good on paper.
The objective measurements for pelvic organ prolapse improved, and their scores on the Female Sexual Function Index went up across all 6 domains. So if a machine can just wave a wand and genuinely improve the tissue structure in 6 sessions, why are we telling people to do months of muscle training?
It is a really compelling argument. And it's important to understand how these devices physically work to understand the catch. Radio frequency and laser devices emit concentrated energy that causes controlled thermal damage to the vaginal tissue.
So it's essentially heating the tissue to the point of minor injury to trigger a healing response, like microneedling for your face, but using thermal energy internally to force the fibroblasts to rapidly produce new collagen.
That is the exact mechanism. And in small, short-term studies like the Higgs trial, that acute inflammatory response does temporarily plump the tissue and create a sensation of tightness.
Okay, temporarily.
Right. We have to zoom out and look at the global regulatory reality. When organizations like the National Institute for Health and Care Excellence, NICE in the UK, review the entirety of the literature, they classify these devices as strictly investigational.
Meaning there is no robust long-term data proving that this newly generated collagen actually lasts or that it improves long-term function without causing harm down the line.
Exactly. And it goes much deeper than just a lack of long-term efficacy. There are severe documented safety risks. The U.S. Food and Drug Administration has issued major safety communications specifically warning against the use of these energy-based devices for vaginal rejuvenation.
What kind of risks are we talking about?
The FDA highlighted adverse events, including severe vaginal burns, deep scarring, and persistent chronic pain.
And scarring is the exact opposite of elasticity. Like, if you repeatedly burn the tissue and it heals with rigid scar tissue, you are actively destroying the organ's ability to act like an accordion.
Precisely. You're ruining the elasticity. And the pushback against the commercialization of these devices is escalating globally. The Australian Therapeutic Goods Administration, which is their equivalent of the FDA, they conducted a massive review of the clinical evidence.
And what did they find?
They concluded the risks vastly outweigh the unproven benefits, and they have actually made the regulatory decision to cancel all approvals for vaginal rejuvenation devices effective in 2025.
Wait, they're literally banning them from the market.
Yes, completely.
That is a massive regulatory hammer to drop, and it speaks volumes about the lack of scientific consensus behind the marketing. But, speaking directly to you, the listener, it makes complete sense why these treatments are a multi-million-dollar industry.
Of course it does.
This physical symptom is so intimately tied to your relationships, your self-esteem, and your fundamental sense of feeling at home in your own body. When you feel a loss of sensation, the desperation for a quick, high-tech fix is a completely rational human response.
It really is.
But it is critical to look past the glossy brochures promising to hack your biology in 6 easy sessions.
The safest, most effective path requires working with the body's natural capacity to adapt and heal. That means identifying the true root cause, whether it's muscle or tissue, and utilizing targeted physiotherapy or localized hormones.
Yeah?
Even surgical interventions, like a vaginoplasty, are strongly discouraged by medical guidelines, unless a woman has a severe structural pelvic organ prolapse. Surgery inherently risks nerve damage and can easily push a woman into that overtight, painful Goldilocks zone we discussed.
We have covered a tremendous amount of biological ground today, so just to synthesize everything we've pulled from the research. The physical length or size of the vagina does not scientifically dictate your sexual function,
Right.
nor does it cause the perception of laxity.
Right.
The tissue is a brilliant, dynamic accordion designed to expand and naturally recoil.
And when that feeling of looseness does occur, it is almost never a case of permanent anatomical stretching. It is a symptom of either exhausted pelvic floor muscles acting like weakened suspension cables,
Or a drop in estrogen causing the connective tissue to lose its moisture and fragment its elastin.
Exactly.
And tighter is absolutely not always better. Extreme tightness leads to spasm and pain. True function lies in the optimal resting tone of the Goldilocks zone, achieved through proven patient therapies rather than investigational thermal devices.
That's the main takeaway.
But as we close this deep dive, there is one final angle hidden within the psychological sources that we haven't touched on, and it really completely reframes the entire conversation.
This is an important one.
It really is. The data consistently emphasizes that sexual satisfaction is incredibly complex. It relies on partner communication, psychological presence, and feeling liberated in your own skin.
Yeah.
Knowing now that vaginal length and size have no biological bearing on function, we have to look outward. How much of the clinical distress surrounding vaginal laxity is actually an internal mechanical failure?
And how much of it is a psychological burden imposed by external forces?
Exactly. We live in an era where the multi-billion-dollar adult film industry aggressively shapes our partner's expectations of what normal anatomy should look and feel like. We have to ask ourselves, are women pursuing painful, expensive thermal procedures because their bodies are actually broken?
Or is the medical anxiety around laxity often just an attempt to surgically treat a partner's culturally warped expectations?
Right. Are we pathologizing the female body's perfectly normal, beautifully resilient adaptations?
It is a profound paradigm shift. It forces us to question whether the standard of normal we are desperately trying to bounce back to is based in biological reality or manufactured fantasy.
Your body is not a broken piece of memory foam. It is a highly evolved, living structure designed to do incredible things. Thank you for joining us on this deep dive. Keep questioning the narratives around your health, demand the science, and above all, give your body the grace it deserves.